নমস্কার, দেখছেন কলকাতা টিভির সঙ্গে রয়েছে আমি স্বর্ণালী। আর শুরু করছি আমাদের বিশেষ অনুষ্ঠান ডাক্তার বলছেন। ডাক্তার বলছেন আজকে কিন্তু আমাদের যে আলোচনা তা কিন্তু শিশু সংক্রান্ত, এবং সেখানে কিন্তু অভিভাবকরা যারা রয়েছেন অর্থাৎ মা বাবারা যারা রয়েছেন তাদের আরেকটু বেশি করে সচেতন করে তোলারই আমাদের এই প্রচেষ্টা আজকের। এবং ডাক্তার বলছেন আজকে আমাদের সঙ্গে এই মুহূর্তে উপস্থিত রয়েছেন অ্যাপোলো চিলড্রেন্স হসপিটাল চেন্নাইয়ের চিলড্রেন্স অর্থোপেডিক ডক্টর আর শঙ্কর। ডক্টর আর শঙ্কর, আপনাকে স্বাগত জানাই আমাদের এই অনুষ্ঠানে, ডাক্তার বলছে অনুষ্ঠানে আপনাকে ওয়েলকাম। What the first question I want to ask to you, Dr. Shankar, that why the children's orthopedic is different than the adults orthopedic?
Namaskar. If your child has any problem, you go to a pediatrician for a medical help. You don't go to an adult physician. The same thing like that, if your child has any orthopedic problem, you go to a child orthopedic surgeon. They will understand the child's orthopedic issues and treat in a better way than an adult orthopedic surgeon. Children's bone is growing. As it grows, if you don't treat it normally, they will have a problem. Children's bone is like a green stick. If you break a green stick, it doesn't break into two pieces. Whereas an adult bone is like a dry wood. If you break it, it will break into two pieces. So the treatment is totally different in an adult orthopedics.
If there has any fractures in children's, why they are different than adults?
So most of the children's fractures can be treated conservatively. I mean without doing any surgery. Even if the surgery is done, minimal surgery is more than necessary. Also the bone, both ends of the bone is a growing bone. If you go and damage the growth plate, the bones will start growing crookedly. So you have to take extra care in preventing damage to the growth plate.
Dr. Shankar, how could the parents can understand that this is different? How could you avert the parents?
So the parents have to realize, that's what I'm telling you, bone health is very important. People don't give importance to bone health. Like when we were children, we never went to a doctor to get medicine. We don't take any vitamin medicine when we were kids, but nowadays the parents come to the doctor and ask for a prescription for vitamins and medications. Why? Because the lifestyle has changed. When we were children, we used to go out and play in the sun. We used to run around every day, so our bones were very healthy. But nowadays, children spend most of the time in the couch. So spending time on the computers and video games and all those things, that is a problem. For a child's bone to have a normal quality, you have to have adequate calcium, adequate vitamin D and adequate sports activities. For a calcium, each person needs about 500 milligram calcium every day. It is there in the normal diet. But whereas a growing child, pregnant woman, lactating mother, they will need double the dose. So how do you get? Only in those situations we can supplement. For a calcium to be absorbed in the body, you need vitamin D. The only source of vitamin D is sunlight. If you are not exposed to sunlight, whatever amount of calcium you take will not be absorbed. So you have to go out and play about 30 to 60 minutes every day. That will make your bone strong.
অর্থাৎ বোঝাই যাচ্ছে ডক্টর শঙ্কর কিন্তু বারংবার যে বিষয়টা বলছেন যে একেবারে যে বেসিক যে পয়েন্টসগুলো, অবশ্যই আমাদের লাইফস্টাইল বাচ্চাদের ক্ষেত্রে যে নেসেসিটি, সেই বিষয়টাও কিন্তু আপনাদের সকলের বোঝা উচিত যে একেবারে যে এই আধুনিক যুগ আমরা দেখতে পাই যে মোবাইল ফোন আমাদের কাছে রয়েছে, কম্পিউটার রয়েছে, ল্যাপটপ, টেলিভিশন, সমস্ত কিছু রয়েছে, কিন্তু বাচ্চাদের যে বাইরে বেরোনোর সময়, অর্থাৎ উনি কিন্তু বলতে চাইছেন যে বাইরে বেরিয়ে মিনিমাম 1 ঘন্টা বাচ্চাদের খেলা উচিত, এবং অবশ্যই সূর্যের যে রশ্মি সেই রশ্মির সামনে থাকা উচিত, যাতে সেই যে প্রবলেমগুলো তাদের বড় হয়ে চলে আসে বা একটু বড় হতে হতে তাদের মধ্যে যে প্রবলেমগুলো দেখা যায় সেই প্রবলেম যেন তাদের মধ্যে দেখা যায় না। এবং আমি আসবো আপনার কাছে যে পরবর্তী প্রশ্নে ডক্টর শঙ্কর, দ্যাট কাম টু দি বেসিক কোয়েশ্চেন দেন, there has many common birth defects. How could the parents will differ these things?
See, when a child is born, there are some birth defects you can notice that at the time of birth. Like a foot, club foot, we see the child is born with a club foot. Child is born with the 2 fingers stuck together. Child is born with one leg shorter than the other leg. This is visible. There are some problems we don't see that. Dislocated hip, you don't notice that at the time of birth. So it's important for the pediatricians to examine the child properly and diagnose at an early stage. any birth defect which is diagnosed early, which is the treatment started early, will have a good outcome. The same thing, if you don't treat it early, leave it for a later date, whatever treatment you do, you will not get 100% normal.
Dr. Shankar, have you experienced about this? Please share your experience.
Like I'll talk about the clubfoot. You can see, if you go to a rural part of our country, you can still see older children or an adult walking with the foot turned upside down. This is a simple clubfoot. If that patient had a treatment at the time of birth, they would have had a better quality of life rather than suffering through their life with a difficulty in moving from place to place.
What are the lifestyle the children should maintain?
See, the thing is, I was telling you, like outdoor activities are very important. Like nowadays, because the children is staying in one place, it's not only the bone quality is not good, they become obese. We see a lot of children presenting to the hospital to have treatment for obesity. Obesity, if you don't treat, later on will lead to sugar problem, blood pressure problem, cardiac issues. So activity is more important. We'll take a girl, young girl, the osteoporosis is a bone weakness. When they become old, like when the periods stop in women, the bones become weak, they develop osteoporosis. The same women, if they work hard when they are kids, at the time of first period, that's a menarche, if the bone quality is strong, they will have a good quality of bone at the end when they become old. We don't understand that. That's very important for parents to send the children out to do outdoor activities. That's very, very important.
And Dr. Shankar, how could we prevent these things?
That thing is, you have to educate the parents. See, sometimes nowadays parents, both the parents are working. When they come home, they don't want any problem, so they give the phone to the children so that they will play quietly and the parents will have a peaceful evening at home. So that has to change. You have to, even if you have only limited time, you have to try and encourage children to go out and play and give healthy food.
Any type of things, yes. Dr. Shankar, the food habit, how much we need to change the food habit?
See, the thing is, you have to have adequate carbohydrates, proteins and fat, and you should avoid junk food. Like too much of a sweet is not good, too much of a fizzy drink is not good. Children, the fizzy drinks contain too much of a sugar. It makes the children hyperactive. That's not good for a child. And if a child is going to have a meal, it's only 3 meals. You cannot give meals in between. Then only children put on too much of weight, and that's not good for the child.
একদমই, অর্থাৎ আমাদের যারা দর্শকরা রয়েছেন ডক্টর শঙ্কর, তারা কিন্তু বুঝতেই পারছেন যে এই যে আপনি যে বিষয়গুলো বলছিলেন, অর্থাৎ এই যে ওবেসিটি বা এই বাইরে গিয়ে খেলাধুলোর যে প্রবণতা, সেই প্রবণতা কিন্তু যথেষ্টই কমছে এবং সেই বিষয়গুলো যদি কোথাও গিয়ে একটু বাড়ানো যায়, বা যারা অভিভাবকরা রয়েছেন, মা বাবারা যারা রয়েছেন, আপনারা যদি একটু নিজেদের চিলড্রেন্সদের মধ্যে, নিজেদের সন্তানদের মধ্যে এই যে প্রবণতা রয়েছে, সেই প্রবণতা যদি একটু চেষ্টা করেন তা কমাতে, যে ঘরে থাকবে না, তারা বাইরে গিয়ে খেলাধুলো করবে, খাবার দাবার যেগুলো রয়েছে, জাঙ্ক ফুড যেগুলো রয়েছে সেগুলো একটু অ্যাভয়েড করবে, সেই বিষয়গুলো যদি আপনারা মেনটেন করতে পারেন, তাহলে কিন্তু এই যে বিভিন্ন রোগ, সেই রোগ থেকে কিন্তু আপনারা নিজেদের সন্তানদের অনেকটাই দূরে রাখতে পারবেন। The next question I want to ask to you, Dr. Shankar, that we know that sometimes school bags are so heavy and that will cause for the back pain. How do you maintain this?
See, the thing is, children usually don't complain. Children coming and telling back pain, always we have to take it seriously because they won't know exactly what the problem is. So it's always better to investigate to make sure it's not a serious issue. But back pain and school bag is a big issue. Nowadays, because there are a lot of subjects, children carry heavy bag every day to school. Back pain, the government has a regulation for a child. Depending upon the weight of the child, the school bag's weight has to be decided. About 10 to 15% of the child's weight only the school bag has to weigh. But instead of that, children carrying all the books and the notes at home to school every day is not a right thing. So what is necessary, you take it that day, you maintain your school bag light, and also the way you carry the school bag, not on one shoulder. It has to be put on both shoulders properly, not to hang too far down up to the knees. It has to be behind the shoulder. You walk straight, most of the problem will be solved. But a child presenting with a back pain, child complaining with a back pain, always take it serious.
Dr. Shankar, my next question is to get the children's bone cancer.
Whatever we get in adults, children also get. But children are more prone to bone cancer like osteosarcoma and Ewing sarcoma. The child presenting to the clinic with a swelling around the knee or the shoulder, usually they will say, oh, I fell down 3 weeks back, I hurt, then I notice a swelling, they come to the hospital. But actually, history of injury only makes the parent understand that there is a problem. Child will get a bone cancer. If we diagnose very early, we can completely cure the bone cancer. About 20-30 years back, if you have a bone cancer, we have to remove the leg. But nowadays, we are so advanced in the chemotherapy and the surgery, we can preserve the limb, we can put the implant, even we have an implant which can grow as the child grows. So we are well advanced to treat bone cancer as well.
How much time we need for this to cure this bone cancer?
Depending upon the type of a bone cancer, we give initially, once we diagnose bone cancer, we actually give chemotherapy to make the bone cancer to shrink. Once it's shrunk, after 3 or 4 cycles of chemotherapy, that will take about 6 to 8 weeks. After that, we do the surgery to completely remove the tumor from the body.
অর্থাৎ বোঝাই যাচ্ছে যে ডক্টর শঙ্কর কিন্তু বারংবার যে বিষয়টা বলছেন যে আর্লি যতটা আপনারা দ্রুত সম্ভব ততটা দ্রুত কিন্তু চিকিৎসকের থেকে যে পরামর্শ নেওয়া সেই পরামর্শ নেওয়াটা কিন্তু খুবই জরুরি। ডক্টর শঙ্কর, উই নোটিস টু দি চিলড্রেন্স ইন দিস ডে দ্যাট দে হ্যাভ দ্য ইন্টারেস্ট টু লুক ইনটু দ্য ক্যামেরাস অর দ্য টেলিভিশন, দে হ্যাভ দিস ইন্টারেস্ট বাট দে ক্যান নট ওয়ান্ট টু go to the outdoor. So how could you aware the children's?
No, that the parents have to educate the children. Like you have to make it as a habit for the child to go out and play. You have to tell them the importance of going out and playing. It will make them happy sitting at home, watching TV, eating the potato chips, whatever they want, putting on weight. But they have to understand when they become 20 or 25-year-old, they'll come with all kind of a medical problem. I can give you an example. We see a lot of people working in the IT industry come with weak bone like osteoporosis at an early age, 30 years, 40 years, because they work the full day in the office in the air conditioned room. They don't know what is sunrise or a sunset, and they don't eat adequately, they don't exercise adequately, they eat at the wrong time. These are all contribute to weak bone. It's not only the bone health, they spoil their whole health. So you have to think about earning money to have a good life, but if you don't have a good health, whatever money you earn is of no use to you or your family.
Exactly. Dr. Shankar, how could parents manage their children's bone healthy then?
See, the thing is, for a child to have a healthy bone, they have to have adequate calcium, adequate vitamin D, and adequate exercises. So they have to make sure they get a good food which contains calcium, like green vegetables, plenty of milk, or sometimes we supplement with calcium medication, and adequate sunlight exposure about 15 to 20 minutes a day, or every day about 30 to 60 minutes outdoor activities, running and playing. So that only makes the bone healthy. Sitting in the house will not help in any way to keep the bone healthy.
Dr. Shankar, if any person affected with the bone cancer, what are the treatments?
Bone cancer, again, treatment is based on the type of bone cancer you have. We initially take a biopsy to confirm it's a bone cancer. Then we have to do test to confirm the bone cancer hasn't spread to other parts of the body, to that bone itself somewhere, or to the lungs or liver, to other leg or arm. So once everything is confirmed, the bone cancer is only concentrating in one place, we give medicine. we make the bone cancer shrink, then after 3 or 4 cycles of medical therapy, then we go and remove the bone. Suppose if the child is only about 7 or 8 years, we have to think about the child is going to grow up to 15 years. So, we put a prosthesis which can grow as the child grows, whereas a child coming to at the age of 15 years, we put an adult prosthesis so that you do not have to worry about changing it at a later stage.
একেবারে অর্থাৎ কারোর যদি বোন ক্যান্সার হয়েও থাকে সেক্ষেত্রে কোনো ভয়ের ব্যাপার নেই, যতটা আপনারা দ্রুত সম্ভব চিকিৎসকের থেকে পরামর্শ নেবেন এবং চিকিৎসকের কাছে আপনারা যত তাড়াতাড়ি যাবেন ততই কিন্তু সেই সমস্যাগুলো থেকে আপনারা দ্রুত আরোগ্য লাভ করতে পারেন। দ্য সেকেন্ড কোয়েশ্চেন আই ওয়ান্ট টু আস্ক টু ইউ ডক্টর শঙ্কর, দ্যাট দ্য ইনফেকশন, বোন ইনফেকশন আর কমন?
Bone infection in children is very common. Bone and joint infection. Usually the hip joint is the one which is affected. See, septic arthritis we call it. If you don't, septic arthritis is an emergency. If the child has the infection, and that has to be treated very early, otherwise it will damage the joint, resulting in lifelong disability. Also, why you get a bone infection? Child running out and playing outdoors, hitting against the table or falling and getting a scratch, through that infection can get into the bone, or sometimes blood-borne infection we call it. Ear infection, throat infection, infection can go and settle in the bone and can cause bone infection. The problem of infection getting into the bone is if it damages the growth plate, that means the child will have a deformity of the leg or the arm. If you treat it well in advance, we can prevent all those things.
And what are the symptoms about this?
When you get infection, child will not move that leg. It will be very painful. That area will be very warm. The child will have a fever. If there is a joint involved, the leg will be kept in one particular position. Any little movement will be very painful. Any doubt, always better to consult a pediatrician or a pediatric orthopedic surgeon.
Exactly. Dr. Shankar, I want to ask you that the lifestyle, you said this before our discussion, that the lifestyle we should change, and the parents, what are they have the mindset, they have to change their mindset.
See, the thing is, parents come to the clinic and asking for what medication to give the child to make the child healthy. They don't realize when they were kids, they never took any medicine. Why? Because those days there was no TV, no video games. So we come from school, go out and play till it becomes dark. So that gives more energy, more strength to the bone. And when you go home, you feel hungry, you eat healthy food and fresh air, you have a good life. But nowadays, we live in the apartments, we don't see that kind of a sunlight. So you have to compensate in some way, like you have to go make it a point, take the child out to go out and play at least every alternate days, give healthy food to make the child's bone and health better.
What are the stages of bone cancer, Dr. Shankar? Can you please elaborate this?
Bone cancer, multiple stages. The bone cancer can be in the bone, or it can spread into the lymph nodes, or it can spread to other structures like the lungs and the liver. If the bone cancer is staying in the bone, it is very easy to treat. If the bone cancer is spread to the lymph node or the other parts like the lungs and the liver, that means bone cancer has spread to other parts of the body. It is very difficult to completely cure the problem. So that's why early diagnosis and early treatment is very important.
Or back pain can cause for this bone cancer, Dr. Shankar?
No, back pain and bone cancer is totally different issue, but children also can get bone cancer in the backbone.
Okay, so how can we differentiate this?
That's what bone cancer. See, child in the middle of the night waking up and complaining of a pain is a symptom of some kind of a cancer. So we see lot of children presenting to the clinic with a limp. When they walk, suddenly they develop limp and they get a back pain.
What are the limps?
Limp, like when they no, if you have a thorn in your foot, you don't walk normally. You start limping.
That's so natural. Yes.
The same thing like if your one leg is short, you walk differently. So when a child with no problem suddenly start limping, it's better to investigate, because 20% of the time, leukemia and lymphoma, that is a blood cancer, present as a musculoskeletal problem, like a limp or like a back pain. So it's very important. So we cannot ignore all these things. Better to get a medical opinion.
Have there different tests for this?
Yes, a simple blood test can diagnose all this problem.
অর্থাৎ বোঝাই যাচ্ছে যে এই যে বোন ক্যান্সার রয়েছে সেই বোন ক্যান্সারের ক্ষেত্রে কিন্তু বিভিন্ন স্টেজে অবশ্যই রয়েছে এবং চিকিৎসকের সঙ্গে আপনারা পরামর্শ নিলে কিন্তু আপনারা বুঝতেই পারবেন যে কিভাবে সেখান থেকে কিওর হতে পারবেন আপনারা। আমার মনে হচ্ছে এই ক্ষেত্রে সবথেকে বড় যে প্রশ্ন দর্শকদের থাকবে ডক্টর শঙ্কর, দ্যাট ইজ দিস বোন ক্যান্সার কিউরেবল?
Yes, I tell you, like any cancer in any adult, like we can take it stomach cancer or a breast cancer, any cancer we diagnose early, it's curable. That's why we try to do a regular checkup. Like if you look at like for a breast cancer, they teach the woman self-examination of the breast, to in case if there is any lumps and bumps, you have to go and consult a doctor. Same thing like if there is any abnormal swelling in the bone, you have to go and get a doctor's opinion. It may be simple swelling, but always better to involve the doctor. Simple X-ray will rule out most of the problem.
কিন্তু আমরা দেখে থাকি ডক্টর শঙ্কর, নিশ্চয়ই আমাদের দর্শকরাও সেই বিষয়টা জানবেন যে বিভিন্ন ক্যান্সার যখন হয়ে থাকে সেটা কিন্তু বিভিন্ন এরিয়াতে স্প্রেড করে থাকে, তখন নিশ্চয়ই কিছু সমস্যা হতে পারে। ইফ দিস ক্যান্সার উইল বি স্প্রেডিং ইন অ্যানাদার এরিয়াস, দেন হাউ কুড দিস পসিবল টু কিওর?
It's that the thing is, if it goes beyond certain stage, we don't talk about the cure, we talk about the palliative care. So that's why early detection and early treatment is very important.
So how could you know about this? The tests are there?
Yes, yes. We when a child comes with a swelling, we first do a blood test.
Okay.
Blood tests are normal. Then we put a small needle and take that bone and send it for a study. That will tell us if the bone has a cancer or not.
ওকে, অর্থাৎ বোঝাই যাচ্ছে যে ব্লাড ক্যান্সার বা যে কোনো ধরনের যদি ক্যান্সার মানুষের হয়ে থাকে অবশ্যই সেটা কিন্তু আরোগ্য পেয়েই থাকে এবং বোন ক্যান্সারও কিন্তু একই রকমভাবে আরোগ্য লাভ করে থাকে। তবে হ্যাঁ, অবশ্যই আপনাদের চিকিৎসকের কাছে কিন্তু দ্রুতই যেতে হবে। ডক্টর শঙ্কর, আই ওয়ান্ট টু নো দ্য অ্যানাদার কোয়েশ্চেন, দ্যাট হাউ কুড উই দ্য পিপল ক্যান অ্যাভয়েড ফ্রম দিস?
We have to create awareness among the general public. Like we have to people like you with a TV channel and the news and media have to create some kind of awareness. Once a week you create a program on a particular topic, then people who see that, they'll understand, oh yeah, there is a problem, this can be cured. Then they'll consult the doctor and go about it.
So you said that before we are discussed here that parents and children have to concentrate about outdoor some activities.
Yes, the thing is, for like you have to make sure the children's well-being. It's not only the general health, also for mental health. You have to have outdoor activities almost once in a week or twice a week if you can, so that there will be a good bonding between a child and the parent.
Exactly, the bonding is very much needed.
The bonding is very. The thing
exactly.
is, nowadays bonding is missing because you come from work, you are tired, you don't want to know anything about the child's activities. That's very important.
একেবারে ডক্টর শঙ্কর, আমাদের আজকের এই অনুষ্ঠানে উপস্থিত থাকার জন্য আপনাকে ধন্যবাদ। থ্যাংক ইউ ডক্টর শঙ্কর। এবং আপনারাও নিশ্চয়ই বুঝতে পারছেন যে এই যে বোন ক্যান্সার বা ব্যাক পেন, এই সংক্রান্ত যে সমস্যা আপনাদের সন্তানদের মধ্যে যদি হয়ে থাকে, অবশ্যই আপনারা কিন্তু সেই বিষয়ে চিকিৎসকের থেকে পরামর্শ দিন এবং অবশ্যই আমাদের কলকাতা টিভির পর্দায় যে নাম্বার যাচ্ছে সেখানেও কিন্তু আপনারা যোগাযোগ করতে পারেন ডক্টর শঙ্করের সঙ্গে। এবং আজকের এই আলোচনা আমাদের এত পর্যন্তই। অবশ্যই সুস্থ থাকুন, ভালো থাকুন, দেখতে থাকুন কলকাতা টিভি রাত দিন 7 দিন।